Hey there, this is Dr. Mort Orman, and I want to talk to you today about anxiety. Now, anxiety is one of the most common problems that people have when they come to me or other people for help with stress. And I know I had, in my early years of my life, had a lot of anxiety problems myself. So anxiety problems are very, very common and are a big part of what human beings experience in terms of stress. So I thought it would be useful to talk a little bit about it. It's actually a very, very broad subject. It's hard to cover it in give it the justice that it deserves in a couple short videos. But I just want to go over a few simple points that I think can be helpful to people, particularly if anyone listening to this, if you're suffering from significant anxiety and you have that as a big part of stress in your life. There are definitely things you can do about it, but the first thing is you really have to understand it. You have to understand what it is, you have to understand where it comes from, and you have to really get very specific about both the type of anxiety that you have and what's causing that anxiety to occur. So the first thing to understand about anxiety is that all human beings have it. It's hardwired into us. It's something that's genetically and biologically programmed into us and is valuable to us and has been over the years for our survival. And it's something that alerts us to potential threats in our environment and keeps us safe and keeps us alive. And so it's a very important primary human emotion. It's not something you can ever escape from completely or get rid of completely, and you never would want to. But it's something that it's important to understand it's hardwired into us, so it gets triggered frequently in different situations and different circumstances, and it happens automatically whenever we perceive in certain ways, perceive things in certain ways, or look at things or think about things in certain ways, real or imagined or exaggerated. We can stimulate that anxiety reaction in our body, which results from various hormones being released, epinephrine and other types of stimulating hormones, and from the adrenal gland and other parts of the body. So it's a very well-known, well-studied phenomenon, but that's what brings it on. It's brought on by various perceptions, by various thought patterns. And a lot of times we're not even aware that we are perceiving things in any particular way. We just know things are happening and we're feeling anxious. So that's the first thing to understand about anxiety. And then the second thing to understand is that there are some conditions that can masquerade as anxiety that really are not run-of-the-mill anxiety. Firstly, there are a whole bunch of anxiety disorders that are severe forms of anxiety or specific forms of anxiety. But then the run-of-the-mill anxiety that people refer to when they say they have anxiety as part of their overall stress is something that actually could be coming from a medical problem, a medical condition. There are conditions affecting the thyroid gland and the adrenal glands and other parts of the body that sometimes can produce anxiety symptoms that just like certain drugs can produce, medications and drugs, even over-the-counter medications, can produce anxiety feelings. Caffeine, stimulants of any kind, that can sometimes stimulate the feeling in our bodies of anxiety. So you have to be very careful when you're dealing with anxiety to make sure you get yourself checked out medically and you're not dealing with some kind of more serious condition. So if that's the case and it's just a matter of, okay, I'm anxious, I'm having anxiety attacks or panic attacks or whatever, then the question becomes, how do I deal with these? How do I get rid of them? How do I understand them better? And that's a much longer discussion, something I'm not going to try to get into today, but I'll touch upon in some other videos later on this week. But I just wanted to give you that, I just want to introduce the subject today, and we'll talk about it more in videos to follow. Talk to you later.